Well, welcome to the Aging Boomers. I'm your host, Frank Sampson, and this is a show that we discuss so many of the issues facing the boomers, facing their parents, and what, of course, we know is an aging population. And I want to first thank everybody for all their support on the show. Many of you have gone to iTunes and have downloaded our app on iPhone and on your Android phone. So thank you for all your support. Keep sending it out to friends and family to listen to the show, and hopefully go on to iTunes, subscribe, make it easy for yourself, and that way you get updated on each show. Give us some comments as well. I just wanted to tell everybody that today's show is sponsored by ElderCareResourcesUSA.com, information for an aging world. Enjoy informative articles, watch videos, download helpful guides, and learn from nationally recognized experts and connect with key local providers. All of our interviews are posted on ElderCareResourcesUSA.com. Also, if you're there's local sites as well in many areas across the country, including where we are here in California. You could go to ECRBayArea.com, ECRLosAngeles.com, or ECRSacramento.com. So check it out. A lot of great information on there. Speaking about great information, I'm thrilled to have as our guest today Dr. Ethelle Lord, who's the founder of Remembering for You, also a pioneer in Alzheimer's coaching. Dr. Lord is also the designer of the Alzheimer's friendly healthcare workforce model of care, which shifts the present medical model to a care model, making it much more affordable and practical for the needs of persons living with Alzheimer's. She also recently opened up the first International Caregivers Association. The acronym is ICA. And we're thrilled to have Dr. Lord with us and tell us more about this new initiative. So you've been a pretty busy woman, Dr. Lord, and I just want to, first of all, just thank you for everything you do. I think it's great, and we want to learn more. Tell us more about this new venture, International Caregivers Association.
Well, thank you for inviting me. First of all, it's a pleasure to speak with you, and especially showcase the ICA. The ICA came about after Remembering for You, because I found through personal experience and research that there was a need out there for this sort of association for training both professionals and non-professionals. I usually say they're care providers for a fee or for free. And I found that it was universal. It doesn't matter where you live in the world, these cases come up, and also the same problems come up. The cost of dementia care is enormous and weighs heavily first on families and then, of course, on our society in general. So I thought there should be something where we can train an outlet like the ICA to train the professionals and non-professionals alike to do better at providing care and to really create a uniform way of doing that, of delivering that care.
So how is the training done? An international group? I did take a look at your website. You got a expanding staff already. So is it done online? Is it done face-to-face? Tell us a little bit more about that. Well,
it's really done online because I really support the fact that we need to reduce the cost of care. But also, if you realize, if you've ever traveled to a conference, how expensive that is, or training, how expensive that is. So I want to make it affordable for everyone. And so online training, a webinar, but we have a unique training program that's called inquiry-based learning, which asks questions of our participants, our learners, and also ask them to do some field work after each training, which really makes that learning more valuable to them and actually anchors that knowledge, and they can go out and practice it. So it's very different than most webinars that I've ever taken. And so that was important to me, that it be done as though the person is in the classroom. Now, we really appeal to all people, all countries, and so we have quite a large group, like in Africa and in India. Those third world countries, they're very poor, and we want them to have the same knowledge. So we do have what we call a humanitarian program, where when they show that they are in a third world country, extremely poor, destitute, we will offer them a full scholarship. So nobody is left out. That's really important, that everybody gets on board and participate. And because Alzheimer's and dementia is universal, we know that there's no specific, it's not like you're ingesting too much salt or breathing bad air. It's everywhere. So what's causing that? We want to know. So we look at a little bit of the research. We also look at administrators doing analytics and metrics to provide services for less money and better services by training their staff. Frank, I noticed one thing. When you have undertrained staff and understaff in general, that's a recipe for disaster, and I've seen that firsthand. So we want to address that as well.
So, obviously, this is one of the ways you're promoting it, but I think what you're doing, being on our show, of course, but it's tremendous what you're doing. I think the idea is great. How are you just getting the word out around the world? Are you going through the medical, through the medical community? Are you trying to reach out directly to the public? How are you going about doing that?
Well, we have a strategic plan because we have just opened this year, so we are moving in a strategic fashion. In other words, we're going to target first the nursing schools, then the medical schools, then the programs at university in gerontology, everywhere. But we do that through the press. We do press releases. I think you have one there. Right. Concerning changing the course of dementia care. We also do it through social media. And the best way we do it is because we have a unique program for international team members. And we're in every region of the world. There are 6 major regions in the world. We're in everyone. And those people typically will take the press release and promote it in Africa or the Middle East. We have people everywhere. So we count on them promoting the ICA, using our brochure, using our press releases, using our information that we send to them. So we have fingers everywhere, and at the same time, we get the pulse. It was important for the ICA to get the pulse of the world because it's a world problem, and not just here in the United States or North America.
Yeah, if I can, I'm going to just read the first paragraph of the release I have, if that's okay. And it just came out. The newly formed International Caregivers Association, ICA, has created a revolutionary dementia care program that will reduce the costs of caring for patients with Alzheimer's disease and other dementias, while simultaneously improving their quality of life. Now the association is sharing this program so caregivers around the world can learn highly effective techniques they can begin to practice within minutes. So that's the first paragraph, and I know people could learn more going to your website.
Yes, and let me prove that to you.
Okay, great.
I asked this question. Do you know that there is a special method, toothbrush and toothpaste, for dementia, people with dementia? And most people say no. Well, right. We can show you that in minutes, how to do that. It's on the website. And it's free to anyone, that part. There's parts that are not free because you have to be a member to reach that. But this particular one I'm talking to you about. Now, how useful is that? Because we know that that dental hygiene is very important for a lot of different conditions. And in dementia care, we know that people typically who are living with dementia will be resistant if the care provider doesn't know those techniques. So then they get resistance, and most people call it aggressive behavior. It's never aggressive behavior, it's resistance. I think the care provider that doesn't take time to learn these techniques is rather aggressive towards the care recipient. So I think it's important. So that's one thing. We also teach how to speak Alzheimer's in 20 minutes. Mm-hmm. Who wouldn't have 20 minutes to learn how to speak Alzheimer's?
It is a,
and the other thing that we say
it is a different language, too.
Say that again?
It is a different language as well.
It is a different language, but I can teach you that, and you'll be effective, and you'll know it in 20 minutes. How great. Useful would that be?
Yeah. So is your target more the family caregivers or the professional caregivers?
All of them, because you see, the first line of care is with the families. That's where the first people, they find out they're sick and they take care of them at home. At the same time, though, as they take care of at home, a doctor had to say, you may have Alzheimer's or you may have a form of dementia. So the doctor is also involved. So I can't separate the two. The two have to come together.
Mm-hmm. Are things changing in the medical profession? I know that, and I was just told this from friends of mine who are doctors, went through medical school. The amount of training that they get in dementia and related diseases like Alzheimer's is just so limited. Is that changing?
Not really, because there's no research that shows you that there's a cure or a cause for Alzheimer's in particular. So the information they have is pretty well standard. But I have written a primer, an Alzheimer's primer, that helps doctors and nurses and even families, and it's called simply How in the World and Now What Do I Do? And that's the very first question the person will ask, the family and the person living with dementia. And that primer contains just the essential, very easy to read, very easy to refer to each section. Matter of fact, there's a psychologist in New York that refers to the primer, the Alzheimer's Primer, as is Alzheimer's Bible, just because of the way it's written. And it's available at Alzheimer's Primer.com, Alzheimer's with an S, Primer.com.
Primer, Primer.com, right?
Primer, yes.
Okay, all right. Can we talk about, I know you're saying doing it for far less costs. Can we talk about that a little bit? Let's say a family caregiver who's, dealing with a loved one with dementia and kind of doesn't know where to turn and wants to get some additional training. What kind of costs are involved?
Well, first of all, it's very reasonable, more than reasonable, the cost of our training. The reason I say that you're going to reduce the cost is because I don't know if you're aware of the family caregiver having the caregiver fatigue timeline, which gives you only 50 months. After 50 months, you break down and you probably have a major illness yourself, whether it's cancer or stress or heart disease, or at least 30% of them will die by the time this is over, and maybe not even finish the term of 50 months. So families need to know the best possible care they can give at the least amount of energy and stress that they can put out. And that's one thing that we do. But there's a lot of things on the website that are absolutely free, so if they didn't want to spend any money on training, that would be their choice. But if I were starting and I had the ICA, I would have, 15 years ago, I would have gone to the ICA because it's extremely exhausting. Now, as far as the care goes for, right now they put people with dementia at the end of the family caregiving. They will place them in long-term care. And as you know, long-term care is very expensive. Mm-hmm. We promote the fact that there doesn't need to be a medical environment like a nursing home, or even assisted living has some help, but they're not trained for that. It's really a chaos. So we say we need to eventually look at care, social communities. That's what I call them, CSC, care, social communities. Mm-hmm. They will be less expensive, where families can actually move in with their loved ones. If you don't have a family, we'll make one for you, because this is an enormous problem everywhere. and we need to really tackle it properly. Now, if doctors know and emergency rooms know how to speak Alzheimer's, they can do better at serving that population. And that would be costing less because they won't take so much time or they won't be guessing.
Give our listeners kind of a quick overview of maybe a couple courses or sessions, whatever you call them. Can you give us just a couple of examples and how long it would take, and are there videos, and just give us kind of a quick overview?
Yes, we have for the very reason you said. A lot of people don't have much time. We have some very short videos that can give them information, lots of information, really quickly, things they can apply immediately. And we've selected those videos ourselves, or we've made them. But we've found them on the Internet, and we put them together. That's another thing that family caregivers and a lot of professionals don't have time to look over the Internet and look for these videos. So we have those. Most training lasts for about an hour, and you can get a credit, or you don't have to have a credit, CEU, if it's not important for your licensing, because we're looking to get the IACET accreditation, which is an international accreditation body, and for all our training. So training is usually an hour. The first one in September will be on analytics and metrics. That's especially important to administrators and owners of assisted living and long-term care because he will show them, and he's a doctor, an MD, he'll show them what you need to look for in your population, what needs to be provided, and so on and so forth, because he claims that once you get to assisted living, you have at least an average of about 5 major conditions, whether it's high blood pressure, heart condition, cholesterol, dementia, and so on and so forth. So he will look at those needs and address those and show them how they can save money by planning and strategically reviewing the population that they're serving. That's the first one. The second one will be on speaking Alzheimer's, and I'm sure that class will fill up. And then we have some on caregiving, just really good tips on how to take care of someone when they speak to you, what happens, the stresses, and so on and so forth. Very important, and your health. The health of the caregiver. Now, remember that even the professional caregiver, like the CNAs, have some stressors that are enormous, especially because they're undertrained. They have no idea what to do, and it overstresses them, so they burn out faster, more costly to the organization because each replacement is thousands and thousands of dollars, maybe hundreds if it's a nurse. And then we're going to have, for example, one training on preventing falls. Fall prevention is really important. You know that each time someone falls, whether they're in long-term care, assisted living, or at home, you're looking at about $12,000 minimum when you go to the emergency room for a fall. And they have to go to the emergency room to make sure that they haven't broken a hip or some other bone because they can't tell you, right? So it's really important to prevent falls. How do you do that? And those kinds of things that legal matters also are part of our training. We have other alternatives to medications that they're prescribing now for Alzheimer's that really don't work. We have alternatives for that. We will show you that and help people to make better choices.
Yeah. Dr. Lord, there's, as you know, there's a number of different, there are organizations out there, but everyone has its own strategy on how, they're reaching out. But how does the ICA differ than, let's say, an Alzheimer's Association or other groups like that?
Yes. Well, all those associations are very good if you're just starting and you want to find some information, general information. The ICA is more targeted to specific markets, and also our dementia care training, we call them dementia care training solutions. It's a breakthrough because it really works. So we know we break through the dementia, we break through the services, and we break through the cost, the high cost of dementia care. The other organizations, and there are many, many, hundreds, maybe thousands. Like I say, there's a lot of information out there, a lot of books available, and so on and so forth. And we want to really funnel the most essential information that people need, and we know that it works. We are very selective in the training that we offer and the information. We also offer a think tank, dementia-care think tank, which I've never seen anywhere. On every issue that we train on, we will have a dementia-care think tank session for people to discuss matters, to just speak up and get even more information.
I think what you're doing is just tremendous. And I think it's important, if you'd like to just chat about it a minute. I mean, unfortunately, you've gone through this experience personally. Would you like to just chat about that a moment, as far as kind of what led you to all of this?
Well, yes, because I've been there, and that's what I say at Remembering for You, because I've been there. For 15 years, I've been taking care of my husband, and he's still doing extremely well. I was able to reverse all his symptoms, so now he speaks and he can move, and that's changed the way that his care was presented to him and how well he's doing. He's never lost an ounce of weight. He's very active, and I take him out every day in the summertime. That it's nice, and I do things with him that keep him healthy. And it's very important to know, for people to know, and I want them to hear this, is that the same man that was sick 15 years ago when I went to the Alzheimer's Association, I was told he would forget everything and so on and so forth. He has not forgotten anything, and his words and his expressions when I was able to reverse his symptoms were the very same. They were appropriate. They were the same as always. So I know nothing is lost. It's just that it's confused, and you need to look for it. And we will show you how to find it.
And that's great. So how long ago was your husband diagnosed? How long has it been?
Well, he started to show signs in the 90s and late 90s. In 2003, he was diagnosed with Alzheimer's, and then later on with vascular dementia. And that happens a lot, is that doctors really cannot diagnose accurately Alzheimer's, which is because there's no cause and no cure. So I understand that. So it's almost like when you get depressed and they will start to give you antidepressants, and then they find one that works the best. And you wonder, how come they didn't find that first? Well, they didn't know. And so this is the same thing. So he was diagnosed in 2003, and I kept him at home for a good I took care of him at home for at least 10 years. And then for the last 5 years, 4 years now, he's been in long-term care.
And I find it interesting, the people that take care of him in long-term care, have you insisted they go through your training? Or have they had pretty good
I've
training?
trained them myself.
Have you?
I asked the administrator to sign up her workers, but it's always the bottom line. If they can save $1, they don't want to do it. So she signed up herself. She registered, but did not sign any of her workers. And so I've trained them the hard way. I mean, I went in there and showed them, sat them down, and even did a presentation once on the elements of care, and told them what was needed to be a good caregiver. And that it just is not there. People that work in long-term care or assisted living have absolutely the minimum of training. Just the minimum. So they can't possibly deal with some of these specialized cases like my husband's and others. It's very hard for them. But I've trained them. It took them months to learn.
That's I mean, it's a great story. I mean, it's unfortunate with what your husband and yourself have to go through, but 2003 was diagnosed. I mean, maybe you could tell people kind of what are kind of the averages as far as life expectancy. It's he's beat that many times over. Yes,
well, that's another erroneous statistics from some of these things that you can go to on the internet and find out, what is Alzheimer's, what are the signs, and how long is life expectancy. I can tell you that life expectancy, sit back and relax, it can be decades. It can go 30, 40 years. Seriously. And so it's important not to stop at months or years, like months or 8 years. At first I was told maybe 8 years with vascular dementia.
Right.
And here he is way past that, and I see at least another decade in front of him.
Yeah. Well, we have just another minute, so Dr. Lord, tell people just about the site, where to go. Go
yes,
ahead and,
the website is the International Caregivers with an S Association.com. So International Caregivers Association.com. And my phone number is 207-764-1214 if somebody wants to call me directly. Sometimes that's easier for people.
So
and my email is Lord, Lord, at icareasssoc.com. icareasssoc.com.
And again, your phone number is 207-764-1214.
Yes, and we need members. We need members at the ICA so we can continue and change the course of dementia care. Please, if anybody wants to take part, help us and join us. Join our community to make that change possible.
Yeah. Dr. Ethelle Lord, International Caregivers Association. Go to the website, International Caregivers Association. Is it .org, right? .org.
.com.
Oh, .com. Okay, International Caregivers Association.com. Check it out. I think what you're doing is tremendous. Thank you so much for being on the show and on the Aging Boomers, and we'll have to have you back. Lots to talk about, so feel free to let us know when new news comes out and you want to share it. We'll have you on.
Much appreciated. Thank you, Frank.
Thank you.
Thank you for your work.
Thank you so much, and thank you all for joining us. Again, you could go to agingboomers.com to listen to this interview and all the others in the past that we've done, and you could also go to iTunes. Just type in the Aging Boomers and we'll come up. You could download a free app on your iPhone or Android phone. Again, the Aging Boomers. So thanks so much. Be safe out there, and we'll talk to you all soon.